Hello, Madeline.
Hi,
How are you doing, young lady?
I'm doing really good. How are you?
Not too bad, not too bad. Thanks for asking. So, young lady, what have you done cosmetically before on the face?
I've done nothing cosmetically before.
Nothing. Okay, so what can I do for you?
Today I came in for a liquid nose job and a lip augmentation.
Okay, okay. What about them?
What do you
What
mean?
about your lip bothers you?
I just don't like. I know I have a full top lip, but what bothers me is my bottom lip doesn't really match my top, and I just kind of want. I love makeup, so I just kind of want that extra like look when I put on lip gloss and or lipstick and stuff like that.
Right. You do actually have very beautiful teeth,
Thank
which
you.
having more beautiful lips is going to be actually really augment everything together. I do agree with you that a little bit lower lip poutiness, if that's a word, is going to be really good. But on the upper lip, I want to have a bit more shape, a bit more borders, and combination of both is going to be really good on you. And then about the nose, you kind of dropped some lines for me that you've been surfing, and what happened?
Oh, okay. So I've used to surf a lot when I was younger, and when I was at the age of 13, I got in a surfboarding accident where I was duck diving, and one of my girls on my surf team failed to duck dive, and her longboard went straight into my nose. And yeah, in a 7 foot day also. So I have a
Ouchie.
little bump,
Okay.
but luckily I can still breathe and everything like that. Just I'd like to get it
Very
fixed
good,
and
very
evened
good.
out.
Very good, perfect. Okay, so young lady, go ahead and slowly turn this way. More, 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 more. Very good. So now here we see it. So there is a hump at the middle, and then there's a dent underneath that. So we are gonna actually take care of that and slowly go to the other side. Yes, go turn this way and go to the other side. Perfect. Okay, and the same thing on this side, maybe a bit better, and come back slowly to 45 degrees, and slowly more, more, more. Minor deviation as well. You do have. So nose actually is going to turn out really good because you do have a very beautiful tip. Base is really good, and minor straightening is going to be really good. What kind of questions you might have on the nose or lips?
I was just wondering if it hurts, and also when I'm able to go out after the
Go out to
procedure.
do what?
Um,
Going out, you can go
like
out right after.
go to the beach or
Ah,
something
okay.
like that. I'm
That
not
out,
sure.
out.
Yeah.
Yeah. So any sort of filler, anytime you do, your skin is going to be more sun susceptible. So then I kind of think that you should avoid any sort of direct sun for a couple of days after any sort of fillers,
Okay.
and then you're going to be a bit more aggressive on sunscreen. So that's one thing. Number two is when you do your lips, you'd have tendency of swelling if your blood pressure goes up. So then I would possibly think that you might want to avoid exercise or strenuous exercise at least for 2 days, kind of a thing. So
Okay.
that's the other one. But having that said, generally you can go back to normal life, except the fact that your lips are going to be a bit too big today and tomorrow morning.
Okay.
But tomorrow noon you're going to be presentable, and day 4 everything should be really good, and you're going to be liking them.
Okay, perfect.
Okay. Anything else?
I don't have any other questions.
Lovely.
Those are the only
Okay.
two.
Yay. Shall we start?
Yes, let's start.
Okay, let's do it. Hello again, Madeline.
Hi again.
So, you're numb and swollen. Do you feel it?
I do feel the numbing. I don't
Okay.
feel the swelling.
Because you're so numb.
Yes.
Okay. So, Madeline, how was the pain?
The pain wasn't, there was barely any pain. And if it was just a little pinch because of the needle, but it was an amazing experience.
Oh, thank you so much. Okay. Do you want to look at yourself?
Yes, I do.
There is, and sorry for the laughing outside. I don't know why people are so happy out there. Anyways, so go ahead and take the mirror on your right side for me. And lovely. Okay, so tell me if you see any changes on the nose or on the lip.
I see many changes,
Many
and I
changes.
love it.
Oh, okay, very good. So there's no bruising on the nose. There's one micro bruise on inside the lip that you don't see, or maybe you do see it inside, and that's all. There's lots of swelling here or there. I think the result turn has really good. Nose is way more straight, and I'm going to see you in 2 weeks to make sure everything is good, and we are going to address the rest from there. I personally am very happy. Avoid sun exposure and exercise as we talked about for a day or two, and then I'll see you in 2 weeks.
Okay.
Thank you so
Sounds
much,
good.
Madeline.
I love it.
Thank you.